Hey guys, this is Dr. Anisha Galhotra and I've secured an All India rank of 352 in this year's NEET PG 2024. I'd also secured an All India rank of 109 in November INICET 2023. So I'm back again with another video, and in this video I'm going to be sharing all the resources that I followed during my preparation phase. I'd also be sharing some tips and tricks that I gathered during this preparation phase of mine. So let's just get started. Before starting off with the video, I'd like to tell you two things about this video. First, that this is basically for all the interns and the post-interns who are going to be sitting for the upcoming NEET PG or INICET. This is not for people who are in their profs, because I feel that they should resort to the main videos for concept building. Secondly, this is my very honest and transparent take on the resources that I followed. Please feel free to follow any platform, any teacher you like, whoever matches or clicks that vibe, please follow them, because there are so many amazing mentors out there, and you should just watch whoever matches your vibe. Let's just get started with the video. So I'm going to just rush through all the resources first, and then I'm going to tell you what apart from these resources I did, right? Starting off with anatomy. So for anatomy, I would recommend you doing Marrow RR edition 8.0 because Dr. Ashwini has very recently joined Marrow. So I watched Dr. Ashwini sir's rapid revision videos only, but that now is included in Marrow RR only, right? Secondly, please focus on neuroanatomy and head and neck, because I sincerely feel that limbs get covered in ortho. The abdomen and the thorax region gets covered in surgery. What is left entirely to anatomy is that neuroanatomy and head and neck, and you do get asked deep and complicated questions from neuroanatomy and head and neck. So just focus on these two things in anatomy itself, right? Coming on to the second thing, there is a histology PDF of Dr. Ashwini only, very easily available on Telegram. Please resort to that because you don't need to miss out on histology. That is not covered in any other subject, so please focus on this. I would also recommend you doing BTR because Zena ma'am is very splendidly given the most important crux part, so please follow BTR as well. Now you just need to do BTR 2.0. That is just a compilation of BTR and BBTR, which was in the 1.0 edition, so you can just follow BTR 2.0 anatomy video, right? In my opinion, this would suffice for anatomy. Coming on to the biochemistry bit, now I have, I resorted to BTR. I also read first aid, and I concluded that ma'am has covered almost everything that was in first aid, which is important for NEET PG. So what you can do is either you can do BTR or you can do first aid, and this is a complete source of biochemistry. I would feel you don't need to club these. Either do BTR or first aid, or if you don't feel confident with either of those, you can just stick to Marrow RR. That would suffice. But do either of these. That would suffice for biochemistry. Coming on to the physiology bit. Now physiology gets asked a lot in INICET, so you need to go through the graphs class and formula class, which is given in compiled module of BTR. BTR 2.0 does include all the BTR and BBTR, which was in 1.0, but the compiled module section, you have to still go through that. So just watch graphs class and formula class, especially for INICET. Then also do Marrow RR, I would say, because Dr. Krishnan sir is an amazing teacher. He has taught very splendidly the physiology bit, and you can also do it with BTR. That's just a small class, so you don't need to miss out on BTR for physiology. Coming on to the FMT, I feel Zena ma'am has taught FMT to the entirety, so you can just resort to BTR. You are sorted for FMT. What I concluded, that FMT does get you questions from previous years, same questions, same things are getting repeated, so you can just focus on BTR and do not miss out on the important things of FMT. Just find a PDF which is very easily available on Telegram for poisons, snakes, IPCs and BNS, because they come very handy towards the end. You can just save it, flip through the pages or the PDFs just 1 day or 2 days prior to the exam. It will help you guys. Coming on to the second year subjects, pathology. Yeah. So for pathology, you can just resort to Dr. Preeti ma'am RR, which is on Prep Ladder. Ma'am has taught pathology and microbiology in a very amazing way. You can just follow Preeti ma'am for both pathology and microbiology. Or what you can do is, you can do Marrow RR, but then you'll have to club it with BTR. Illa ma'am is an amazing teacher for pathology, but just club BTR for that, because ma'am has highlighted the most important crux parts. Do not miss out on histopath class of BTR. That is an amazing compilation of all the images given in Robbins. Zena ma'am has put in a lot of effort. Please do not waste that and look for all the images that are in the Robbins. Just watch this class, right? Coming on to pharmacology, so everyone knows, and I have very sincerely followed GRG sir. I think he's hands down the best teacher on this planet, especially for pharmacology. Now, one tip for pharmacology that I'm going to tell you is that pharmacology is the only one subject that I would recommend you watching from the main notes, because every year new topics get asked, and that too in very, very depth. So you need to know so much about pharmacology, and who better to go to than GRG sir for pharmacology. So I would recommend you watching the main notes. Just take a PDF of it and just watch just read pharmacology again and again and again. What I did, this is my suggestion for pharmacology. I had my schedule written down on a piece of paper, but towards the end, in the last 1 hour, I just used to read 15 to 20 pages. This was a schedule, this was a routine. I did it, I complete pharmacology, then restarted the cycle. This way I'd gone through the main notes of pharma thrice or 4 times, and that was really, really helpful. That played a pivotal role in my exam, because pharma was tough in NEET and INICET as well. So just make your pharma strong, it will give you an edge. What you can do is you can watch GRG sir main notes or RR. And yes, of course, for 2 subjects, for pharma and PSM, please look out for the recent updates. GRG sir usually puts out a video of the new antibodies, new drugs which are in the market just before the exam. If you don't get a hold of that, just watch it on YouTube. Sir has a video on YouTube of the recent updates. Watch it just before INICET, 1 day before INICET, and that would suffice, right? For pharmacology, another tip is that what you can do is you can watch the mission NEET on cerebellum. That is a middle ground between the main videos and the RR. RR is a little less, and the main videos, if you feel they are a little bit more hefty, just you can watch the mission videos, right? Coming on to the microbiology bit, you can do first aid. First aid is a whole book for microbiology. It has images as well, so you can just follow first aid, but please remember to include TB in it. TB is not included in first aid, obviously for obvious reasons, right? Or what you can do is you can just follow the OG Dr. Preeti Ma'am RR, and that would suffice, right? For Ophthalm, I would suggest you watching Dr. Utsav Bansal's video, Marrow RR. I think there are 6 or 8 videos, and that would suffice, guys. That would really suffice. If you still feel the FOMO, you can just skim through BTR notes, but I feel that they are basically the same. Ma'am has given certain tips and tricks for Worth dot 3 test and so on and so forth. You can look out for that, but you don't need to do anything other than Marrow RR for Ophtha. For all the surgical subjects, please go and you can save instruments PDF for in the last 15 days. You can just skim through the PDFs. Coming on to the next subject, ENT, same Dr. Manisha ma'am has done a very splendid job. Watch Marrow RR, and that would suffice. Please save instrument PDF for ENT as well. Coming on to PSM. Now PSM is gaining a lot of importance in the recent few years. So what you need to do is you need to watch either Marrow RR or Cerebellum RR. It's your choice. Dr. Mohit sir or Dr. Vivek sir, they both are amazing teachers. But please do add BTR. Zena ma'am has she has done a very good job. She has just compiled everything, because when you read PSM, at the end of reading all the RR as well, PSM is a subject which is all over the place. You can't make out what it tried to say, right? So ma'am has given a very ma'am has highlighted all the crux points of PSM. Tabulated forms, she has given a very good tables of all the programs. She has given it in a tabulated form. So you can just first of all go through the RR extensively, either Cerebellum or Marrow, and then just watch BTR for highlighting all those important stuff, right? And watch recent updates video 1 day before the exam, especially for INICET. You need to know the recent MMR, IMR, so on and so forth for PSM. Coming on to medicine, now I would suggest for people who have made their pathology, pharmacology and physiology strong, they can just resort to integrated system given in BTR, or that is same in first aid. So you don't need to do first aid. First aid is quite hefty. Ma'am has highlighted the major points that you need to remember in the integrated system in BTR. You can just follow that and give a closure to medicine. But for people who feel that they are not very confident in pathology, physiology and pharmacology, just watch Dr. Deepak Marwa's RR notes. They are amazing. But then you just remember that you don't need to fixate on medicine as such. Medicine is very vast. You will not be able to complete it to the entirety. Just pen down whatever resources you will follow and what you will do, and give a closure to it once it is done, right? Coming on to pediatrics. Pediatrics, you can watch Dr. Singaram's videos, RR videos only in Marrow, and then just club it with BTR, and you will be sorted for pediatrics. Coming on to OBGYN surgery. Now I strongly suggest that you watch Marrow RR for OBGYN and BTR. Now a tip for both OBGYN and surgery is that, in both of these subjects, first of all, they are getting asked a lot in the exam. In both of these subjects, just, what you can do, this is what I did. I wrote flow charts on sticky notes, because clinical scenarios are getting asked in the exam. That a patient came to you with abruptio at this week, then fetal heart rate was this, the mother vitals are this, then what is the next step? The next step of management, the next step of diagnosis. So you need to know in your mind very clearly about all the emergencies of both OBGYN and surgery. Maybe write it down on a piece of paper and stick it on the wall, but these kind of questions are only getting asked. Now conceptual questions have lost their charm. You need to know. Now the factual questions have lost their charm. You need to know the basic concept, what needs to be done and when it needs to be done, right, for both OBGYN and surgery. Coming also save instrument PDF for both of these subjects, obviously, because these are surgical subjects. Then for surgery, please follow Dr. Rohan and Dr. Sakshi are hands down the best teachers. Surgery was my weak subject, but they have made it strong. So just follow Marrow RR, but also do BTR. Ma'am has covered all the important PYQs, all the factual stuff. You need to highlight the things which are not covered in RR for both of these subjects and make these two subjects very strong for both NEET and INICET. I feel that Zenam ma'am has helped a lot of people, but now people have medicine as a strong subject. Everyone knows medicine, everyone knows their way through these conceptual questions. But for both OBGYN and surgery, it's still a rough road for so many people out there. So if you master these subjects and if you have an edge on these subjects, you will definitely shine in the exam. So, just put an effort for both of these subjects. Coming on to the 5 paraclinical subjects of final year. For anesthesia, I sincerely feel that BTR is enough. I think 3 or 4 questions are getting asked, and ma'am has covered almost all the important conceptual and the factual stuff, and you're sorted just with BTR. Just club it with PYQs or maybe custom modules and just sort it for anesthesia. Coming on to psych, just do BTR and that would suffice. Trust me guys, BTR psychiatry would suffice. You need to know the timelines accurately and you need to practice questions so as to judge what kind of an emergency or what kind of a disease it is, right? But please focus on psych pharma. That GRG sir will cover definitely, but you need to stress upon psych pharma. It is getting asked a lot, right? Then coming on to ortho, just do BTR and save instruments PDF and you're sorted. Ma'am has almost gone overboard in orthopedics BTR. So what you can do is you can just go through BTR and give closure for ortho with BTR. Radiology, please follow Zenam ma'am. She is OG for radiology. She has given, I think, 6 or 7 hour long video for radiology and you're sorted. For radiology, what you need to do is, there is core radiology stuff that get asked not quite often, that seldom gets asked, but then it gets clubbed with surgery or anatomy or medicine. In fact, you need to know the basic things of radio, the scans, the images that every medicine or surgical subject has, right? You need to know that, and I think that is covered in radiology 6-hour video of Zenam ma'am and is sorted for radio in that. Coming to dermatology, BTR, just BTR, ma'am has added all the Dr. Neena Khanna's images in derma, so INICET also gets sorted. Now coming on to the other things which you need to do, which I did. First of all, of course, GTs. I can talk about GTs extensively in some other video, but please give GTs once every month minimum, or you can stretch it up till once every fortnightly. You don't need to do GTs that often because that much 14 days, 15 days are required for you to make a significant amount of progress. Then coming on to the next thing, please do practice a lot of questions as custom modules or SWTs or mini test, which is given on Marrow. I followed Marrow. Please feel free to follow any platform that you like, but just review the questions. You have to review it, you have to master what you did wrong, only then improvement will happen, right? Coming on to compiled modules, you need to follow compiled modules of BTR. Ma'am has already worked so hard for you, so please don't waste it, just look into it. It has really important, volatile and crux things, just go through it once. Then I also follow TND of BTR. You can follow TND of whatever platform that you like, but just follow a TND so that you can keep a check, so that you know where you stand, right? And also do PYQs. Of course, you have to do last 5 years PYQs of INICET and NEET. Before that, you can do it. There are so many apps. I think there is a Reflex app, and Cerebellum also offers late night PYQ sessions which are before 2017, but that's just your choice. What you need to do is whatever PYQs are given till 2017 for NEET and INICET, just master those and you're sorted. Over and above that, that is personal. That is a very personal choice. Please feel free to follow whatever you like. Coming on to first aid. Now, I very thoroughly did for first aid, but I came to a conclusion that Zena ma'am has already done the job for you. You don't need to visit first aid except for biochem and micro. These are some amazing subjects given in first aid. If you want to do biochem and micro, you can solely do first aid for those. Just add TB for micro and you're sorted. But other than that, guys, you can be sorted. I am giving you that assurance that first aid has almost everything, and ma'am has covered almost everything given in first aid in BTR. So if you have done BTR, you don't need to do first aid at all. Right, guys? So thank you, guys. This was it. Good luck. Like, share and subscribe, and please let me know if you want me to make any further videos. Bye-bye.